Okay, everyone, I want to thank you for waiting so patiently. We'll go ahead and get started. I don't want to take up too much of your time today, but again, thank you for joining. And again, my name is Joan Jenner with CareTime Software. My contact information will be at the end, and we'll leave that slide up. Also, if you want to send any questions throughout the presentation to the moderator, who is Kara, with our product development team and everything else that she could possibly get into. She's wonderful, but she will be fielding your questions, and at the end she will send me the few that we have time for, and then any other questions we will still respond to after the webinar itself. So again, thank you for joining. We're going to talk about the deadline and what's coming up for EVV in Virginia specifically. Also, we work very closely with the Virginia Association for Home Care and Hospice. If you're not a member of that association, I would suggest looking them up. If any agency ever needs any guidance, any information, any assistance with getting things done, especially at the state level or helping you work with DMAS, there is no better group than that group at Virginia Association for Home Care and Hospice. Their website, now I'll do the plug, is www.vahc.org. Debbie and Marcy are just incredible. They have a bigger team, but I will believe that you'll be happy that you reached out to them and became a part of that association. So what we're going to talk about today, I mean, none of this is new to anybody. We will talk about just the overall EVV needs in the state, what it is, why it's being done, current deadlines, options for EVV. So we have, different items that we can use in the software in the industry and talk about openly as well. The EVV software, our features checklist. So we want to make sure that we arm you with the right questions if you're looking at any product at this point to have your agency go with. We will go through a payer update for your electronic claims association update, and then we'll go through contacts, meaning me, and then of course all of the questions that you've sent, or the ones that we can get to, that you sent over to Kara for consideration. So let's go ahead and get started. Why do we need EVV? That question probably goes through your head more than most. Of course, it stands for electronic visit verification. It was passed into law, as we all know, in December 2016. It's a federal mandate to make sure, they want to make sure that the recipients are getting the care that we promise to provide, as well as, unfortunately, it's there, and we need to eliminate Medicaid fraud. So that's where the EVV mandate came into play. State Medicaid programs will lose federal funding if they don't comply. So it's really everybody is trying to get on the same page and sing from the same song sheet. And I think that's important as a state and as a country. Providers, as yourself, will risk loss of reimbursement and audit penalties if you do not implement the EVV system before the deadline. The 6 main elements that are required in EVV, which is rolled into that mandate, is 1, the type of service you performed. In other words, it was a visit and what care and that information that has been done during that visit and what service has been given to that particular individual. Again, the individual receiving the service. So the service that's being done and who is getting that service. And of course, the date of the service. That is most important for your claims. And then, of course, you have the location of the service delivery. Now, electronic visit verification offers usually a couple of different ways, maybe 2 or 3 different ways, and we'll look at that. But it's, telephony, a mobile app, and then there's some other devices as well that we'll look at on the new slide. The individual providing the service. So again, what are we doing? Who's getting the service, who's giving the service, and then what date did the service have, what start, and then the time of the service at beginning and end. So these are the things that EVV and EVV system can provide to you based on the mandate in the Cures Act, and of course the state information as well. These are the same 6 key elements that are required by DMAS for your claims billing as well. So Care Time, for instance, does have the ability to put those claims, that 6 required information, into the claims to be sent over to the clearinghouses. So that is the crux of the entire EVV process. So you want to make sure that if you're talking to any provider, any software provider, that you make sure that you have those 6 items of delivery. Deadlines. Now, the current deadline is September 1st, 2020, to have your EVV information included in the claims. Of course, DMAS was encouraging everyone to be compliant prior to deadlines. This way, when you get to that date, you're not scrambling, you're not, everything's set up in your system, everything's ready to go, and you're already getting claims sent, receiving remittances, and everything is processing great. So of course you want to get your EVV. If you do not have an EVV provider, now is the time. I cannot stress that enough. You also want to make sure that you can be up and running before that September 1st deadline. Currently, there are no changes to that, no delays, and no longer will there be further grace periods at this time. It does take time to implement, train, and get your caregivers in the system. So you would, ideally 1 to 2 weeks to train and implement a system. Obviously, we're under that gun already. So I can certainly say confidently that we can get you up. If you decided to come with Care Time, I could get you up in the next couple of days. So you'll be fine and get your claim started by September 1st. Be a little work on both sides, but, anything's possible. And DMAS and MCOs at that stage, as of September 1, 2020, they can start denying your claims. So as we all know, the most important thing in your agency is getting the money back for the work that's been done, so you can continue to run your agency and pay your caregivers. So Care Time especially, we are very eager to make sure that that process is happening. We know what makes it tick, and we will certainly do everything that we can within our capabilities and powers to get you where you need to be, and in the least painful way possible. So the technology options, as I mentioned before, of course, you should have a mobile app access where they should be able to clock in and clock out, and ideally make any notes, possibly see the care plan notes, gather signatures. So an ideal mobile app will give you give the caregivers basically the agency in their hand, because you want them to be able to give you the information you need about that client, do the right thing with clocking in and clocking out, get some care plan tracking questions answered, capture a signature as well. So those are the things that you want to make sure that a mobile app is going to do for you. Our mobile app has gone a little bit further than that, but if you'd like, I can certainly discuss that with you after the webinar or anytime that works within your schedule. Now, of course, you have the IVR telephony landline. That, for instance, you would have an authorized phone number, which would be that client's landline, and then the caregiver can clock in and clock out via the phone, and then also answer the care plan tracking questions. Now, of course, this is going to be less informational based on the mobile app versus the telephony. So that really is, a choice. So you'll have some caregivers that don't have smartphones and things of that nature, and that's fine. So we do still have an answer for that if need be, or it's a great fail-safe if something happens to the caregiver's smartphone. Now, we also offer an offline Bluetooth where you can get that from us or whomever your provider is again, and you could use this offline Bluetooth to activate and use it for our mobile app. If the client doesn't have Wi-Fi or there's no service in the area, so you would still be able to work in the app offline. And then once you get to service or to Wi-Fi or, like I said, better cell service, then that would allow that data to be sent up to the care time application, and then the agency leaders can see that as well. Offline validators, obviously that's a bit of an older technology, but it still does and suits the need. And this is just in the instance that none of these things are available. So that can be made available if you have certain homes that are just no Wi-Fi, no cell service, no home phone, and so on, then the validator can still work. It is a much older technology, but then again, sometimes, you know, if it works, it works. So that's not a bad thing. And of course, we would be able to teach you how to use that also. What does EVV software do? I mean, this has been a question going on for a long time. Like, what does it do? Why do I need it? What is it really going to do for me? Obviously, the client records, we will maintain those client records as far as their information, their notes, their questions and answers, and caregiver responses. And if you have preferences or certain things that the client requires to keep in the software, caregiver records, so you can do all of the work with the caregivers as far as keeping their information, certificates you want to be able to save and monitor. You, of course, want to be able to put in their pay rate and things of that nature, so you can, you know, quickly collect the information to generate for payroll. So that's important. One less step that you have to do outside of the software. And of course, electronic visit verification. It's going to give you those 6 points of the data that is mandated in the CARES Act and DMAS to be in your claims. And of course, you should have a claim system, whether, you know, for different clearinghouses, we have direct connects with different vendors as well that are aggregators that you can use within the software. So we're always making that more streamlined and a better process for you to do your claims and to have that not be so stressful. Of course, you can, there's so much more. You can have a schedule. We also do an open shift where you can basically caregiver and client match based on preferences in each of those files. So like, has a dog, okay with dogs, smokers, different dementia experience, things of that nature that you can match the client to the caregiver. And of course, we have caregiver messaging, which gives you the ability to take and go into the system and send the caregiver a message as an individual, as a employee type, or a group of caregivers that maybe are in the same area. So that process is also, you know, we're all about making sure that the workflow is clean, simple, and easy, and non-intrusive. We want to make sure that the outside sources don't come in and distract you. You know, because if you had to text people on your phone, then you're on, you know, social media and looking at videos, and there you are, an hour gone of the day, where simply in time you'd be able to go to the caregiver messaging and send a message to 1 or 50 or 500 people, caregivers at the same time. Optional Virginia home care software features. We have worked very hard through every deadline that we've all experienced in the last year, where we have created your DMAS 90 record in the system for you. And again, this does not have to be printed and saved. All it will be in the software to save forever and reportable at any length of time at any time. Again, we have our caregiver matching for open shifts, where you could send a link out to several caregivers to see if out of those matches of who wants that shift, and it's kind of the first one to answer gets the shift. So it's great. It creates a little competition and urgency in the field as well. We also have the family portal. What that is just as it says, it allows the users to give out permission to family to come in and see different things like their schedule and certain notes and things that we want them to see. It allows the client to chat with a caregiver or the agency. Sometimes you want them to be able to approve timesheets, depending on which client that you're using this for. Consumer directed, this was built for a consumer directed world where you can have them approve timesheets or request an edit, chat with the agency. So that family portal is really pretty slick. If that's something that you're interested in, I can certainly discuss that with you and share the screen, and we'll go through that as well. Just last weekend, for those of you who are on the call that are current clients, and for those of you who are not, we just launched, which has been a long wait for me. It's our custom forms builder. You can create your own forms. So if you want to see certain things on that form and ask certain questions and make them fillable, that's up to you. So you can create intake, assessment, inventory, approval, agreements between you and the client. So all of those things can be created in the form builder, and they can be then assigned to a client. So not only can you create a form for the entire agency of clients, but then if there's one form specific for a specific client, you certainly can do that as well. You can upload upload PDF forms, and then so that would maybe be your current DMAS 90. So if you want to really make comfort from what the caregivers are used to, you can upload that DMAS form, and then those soon will be workable via the mobile app. Obviously, between launch and mobile app, there's just a little bit of time, and that's just out of our hands. So we're working through that patiently. But by the time you create your forms and do what you need to do, you will have, you should be able to have that on the mobile app. So that's a pretty exciting feature for us. It's available to all of our current clients, and any new client that would come on board would be able to take advantage of that as well. And then we're going to also put in a few templates, just simple templates. If you don't want to make your own forms, then we'll have just a few of those as well. So really make it yourself, upload it, or use what we put in the system. Care Time is all about making you in control of your agency, and that includes the software process as well. And we're pretty proud of that, the ability to customize as much as we do. So choosing an EVV software. Obviously, we're with Care Time, but we wanted to do this as a representative of a business partner that we can be of yours in Virginia. So first of all, does it record all 6 EVV elements? So again, that was who, what, where, when, and how, obviously. Are there options to go with a mobile app and GPS? So that is something that is most important. And also added to this is ask them what they record. Is it tracking of the app when it's on? Is it just tracking the clock in and clock out? Get those details so you can give an educated answer to the caregivers and the aides that are concerned about GPS and things of that nature, and the fears out in the general population. So know what it's tracking so you can feel confident to say, yes, this is what we're doing. Is it already successful submitting claims to the Virginia payers? Is it already integrated with TELUS for your Anthem claims? Care Time, the answer is yes, but that's something that you want to make sure, and that's very important. Or if you're with a company currently that is providing your software, make sure that they are providing those 6 points of EVV elements as well as the claim into the system. It's into the claim into the clearinghouses. Sorry about that. Can it help with clients? Of course, DMAS 90, caregiver compliance, notes if clocked out, missed clockouts, audit trail of users changing records. These are things as an agency leader that is important, because you want to make sure that if you ever, I've always said to anybody that I've spoken to in the last several years, if you have Care Time and you have an audit, I want you to put your feet up and say, I have Care Time. Because if you can't find it, you're one phone call away from letting us help you find it. And that's, again, just us. I can't say that for any other software provider in the industry, but I know that an audit or compliance or questions, if DMAS changes something, we're on it. If Virginia changes something, we're on it. That is, it shouldn't be your problem. If Virginia changes a mandate and then DMAS 90 comes and hits you with another one, and then it changes from A to Z, you just let us know, provide us the information, and that's our job. So you don't have to sit and be concerned. You have an agency to run. I've always said, if you're working harder than the software company that you use, then you are with the wrong software company and they have failed. What features can make it easier to run my agency? Like I said, workflow earlier. You want to be able to just go over and text 1, 20, 50, 100 people to be basically for whatever you need. If you need coverage, if you want to match your caregiver to your client based on, you know, individual information, that's important. So those things, so you don't have to have, you know, obviously you always want to be as little paper as possible. So we don't want to have, well, Sally is okay with dogs and 400 Post-it notes of other reminders and their availability based on their schedule. Those are all the things that are going to make your life easier and make you more efficient, because I want the leaders of the agency to sit back, let the system help you run your agency, and then you go out and build the agency. That's why we think of ourselves, especially at CareTime, as a business partner. What is support like? You know, is it all emails, all tickets, live person? Do they help with claims? I can speak from a CareTime perspective that you always are able to call, always a live person answers the phone. Some people like support with sending in a support ticket. Some people like to email, and that's fine. We can do that as well. Also, some people are self-support. There's always a little green button in the corner for CareTime users that you can just click support, type in what you're looking for, and then get all of the help files that can help you with that. So how are you going to be supported and lifted up out in the world in Virginia based on the software provider that you choose? I can again attest for CareTime that you're never alone. That sounds creepy, but you're never alone. Do you charge for training and implementation? This is something that you want to make sure you ask before you get started. So if they're going to charge for training, you know, that's kind of iffy. And if they're going to charge for implementation, again, I can only speak for CareTime. We do none of that. We do not charge. You can have 1 training or 10. We're going to help you get set up and get started. We have Virginia-specific things in the software that we will help you put together and make sure that you have the system set up correctly so you have the ability to run the software with ease. Again, if you're working harder than the software company we're using, they have failed you. Training and onboarding considerations. How quickly can you get the account set up? I know today, if you said you wanted CareTime, I could get your account set up before midnight. You know, of course, then you need to do your training and onboarding of both systems and claims. So that is, you know, the setup is clear. It is intense. There's just a lot of buttons and a lot of things to push to make sure that your claims are successful and to make sure that your staff is able to clock in and clock out. Because of course, if your staff isn't trained with the clocking in and clocking out, then your claims aren't going to get done because you don't have the right information. So all of that really ties together. As I said, I could speak for CareTime. We do offer training videos that are very precise. We're updating those all the time. So we want to make sure that they're live with the current mobile app that's out today. We also have videos for the form builder. There's videos for, you know, a good portion of the system that allows you to share that with the team based on what their role is in the business, and then allows you to move forward as comfortable as possible. Training and onboarding for caregivers. Again, it's the software, you know, everybody can tell you that the software is easy. Every software presentation I've heard, it's easy. However, one thing that I can say is that I know, as personally, and Kara could attest as the product development manager, is that we work very hard to make the software as easy as possible. Because again, if you're working too hard, something's wrong. So if the development team comes back with a feature that we asked for and it's too difficult, it's too clunky, we're going to send it right back to them and say, nope, this is not what we're looking for. It has to be easier. These people are busy. So we get it. We definitely get it. Ongoing support and training. As I said, you have different levels of support, and we have different agents that will always answer the phone. We have a pretty strict guideline of at least getting back to everybody that has reached out to us in the same day. We're always all available to make sure that you get the service and support that you need. Sometimes you just need an ear, and we all have, we all have two of them, so there's lots that we are going to be able to offer to you to help you make sure that your agency is running as efficiently as possible. And again, remember, if you have any questions, please send those through the webinar portal, and Kara will be fielding those, and we'll be answering some of the ones that you'll be able to send over to me once we get to that portion. So if you have any questions, comments, concerns, then you can definitely send those over to Kara. Thank you. Payer updates. Now, Anthem, is going through TELUS, as we all know. So you have a TELUS portal, and then you will run the claims directly to TELUS. It's a direct connect to their portal, so you'll be able to send over that claim. You don't have to save it and upload it as we did when we first got started. As I said, when we release a product, all we do is continue to build on it and make it better. So now that is a direct connection, and you can then see any of the process through the TELUS clearinghouse. So that clearinghouse is no charge for them, and they're happy to help you get that going and make sure that everything's working correctly. 9 times out of 10, if a claim doesn't work, it's something in the setup. That we found that historically over and over again. Also, the MCOs like to kind of make it up sometimes as they go. So we're always responsive, as I said, to make sure that we're there for you and get that going. Again, the Virginia Premier, DMAS, Optima, United Health, Magellan, and Aetna, they will go through any connected clearinghouse. The 3 that we work with is Office Ally, Waystar, and Availity. And Change, most are accepting EVV data correctly. We have very successful agencies doing millions of dollars of claims as we speak. So again, however, if something comes up, something changes, Magellan decides to do something with different numbers, or Optima says, no, we want it to the left, not to the right. That is our problem. You get it to us if we don't already know, and we will fix it and update the system and make sure that you're processing your claims successfully. That's how we react to things like that. Every software product will be different, of course. As I said, over $5 million in EVV claims are paid even before the deadline. Now, this is probably higher. The slide was made a little bit ago, so we're probably a little low on that. And currently, as we made these slides, 12 million visits and check-ins are processed by our company every year. We have almost 10,000 caregivers across the board using our products to check in and check out, make notes, answer care plan tracking questions, and now enjoying being able to see the care plans and set their preferences and all of the new features that are constantly being built into our mobile app, and of course using telephony, some of those count for. So we want you to know, we seriously want you to know that we are here to take care of the agencies in Virginia. And a long hand next to the Virginia Association of Home Care and Hospice, of course. Again, if you're not a part of that group, it's something you need to be a part of. Every time when we used to travel, I used to get to meet with them, and I left a better person and more knowledgeable. So, again, remember to contact that group as well. And if you didn't get that, it's V as in Victor, A as in Apple, H as in Harry, C as in Charlie.org. So be sure to reach out to them, go on their site. I know they're doing a virtual conference in November. So we should be a part of that, and we want to make sure that you can be a part of that as well. Great connection in Virginia, for sure. They have helped us throughout the years and made sure that we were always doing the right thing based on the Virginia agencies that we are privileged enough to serve. Again, as I said, my contact information, my email is joan@caretime.net. Just remember it's .net. And our number is 888-400-5048. If you call that number, just let them know that you want to speak to me directly, and they will give it a shot to put me through. If I'm not doing a demo for some amazing agencies already, then I will answer, or if not, I will definitely call you right back. Again, the email is Joan, Joan, at caretime.net. I have a very specific rule, and those of you that are clients know this. If my eyes are open, I will help. So again, you're never alone. I'm always here to help. I'm always up for a brainstorming session. Hey, we do this. How do we do it in the software? Just let me know. Just let me know, and we'll be happy to make sure that we get you the best answers possible, or work it into what you're doing today. All about making you successful, making your life easier and streamlined, and able to work through the processes in Virginia. And really, you serve your clients, we'll take care of the business. That's a very strong, true statement.